Did you know that some of the most trusted pills in your medicine cabinet could be quietly causing you dementia? It's a sobering truth that millions of older adults face every day. These aren't mysterious experimental drugs we're talking about. They're everyday medications that doctors prescribe regularly, pills that sit on pharmacy shelves, and remedies that people have trusted for years. But here's what's truly alarming. Many seniors have no idea that these common medications could be putting their brain health at serious risk. If you're over 60, or if you care about someone who is, this information could be life-changing. We're going to walk through 4 categories of medications that researchers and brain specialists are increasingly concerned about. These pills have been linked to memory problems, confusion, and yes, even an increased risk of developing dementia. This isn't about scaring you. It's about arming you with knowledge that could help protect your most precious asset, your mind. By the time we're finished here, you'll know exactly which medications to discuss with your doctor, how to spot the warning signs, and most importantly, what steps you can take starting today to keep your brain sharp and healthy. This is about taking control of your health journey, not living in fear. So let's dive in and explore these 4 medication categories that deserve your attention. First up, we need to talk about anticholinergic drugs. Now, don't let that complicated name scare you off, because you've probably taken these medications before. They're everywhere in allergy medicines, sleep aids, medications for overactive bladder, and even some stomach remedies. The problem is how they work inside your brain. These drugs block a chemical messenger called acetylcholine, which your brain desperately needs for memory and clear thinking. Imagine your brain as a busy highway system and acetylcholine as the traffic signals that keep everything flowing smoothly. When anticholinergic medications block those signals, traffic backs up, messages get confused, and your brain starts to struggle with basic functions like remembering names or following conversations. For younger people, this might just mean feeling a little fuzzy for a while. But for seniors, especially those who take these medications regularly, the effects can build up and cause lasting damage. Here's a story that really drives this home. Margaret, a 72-year-old grandmother from Texas, was taking an antihistamine for her seasonal allergies and a bladder medication for frequent nighttime trips to the bathroom. Both contained anticholinergic ingredients. Over several months, Margaret's family started noticing changes. She'd repeat the same stories, forget appointments, and seem confused during conversations. They assumed it was just normal aging. But when Margaret's pharmacist reviewed all her medications during a routine consultation, he spotted the problem immediately. These 2 seemingly innocent drugs were working together to cloud her thinking. After talking with her doctor, Margaret switched to different medications that didn't affect her brain chemistry the same way. Within weeks, her family noticed she was more alert, more like her old self. The scary part is how easy it is to end up in Margaret's situation. Many people take multiple medications with anticholinergic effects without realizing they're multiplying the impact on their brain. These ingredients hide in plain sight, not just in prescription drugs, but in over-the-counter products too. That nighttime cold medicine or sleep aid you grab from the drugstore shelf might contain the same brain-blocking chemicals. People think if it's sold without a prescription, it must be safe. But that's not necessarily true, especially as we get older and our brains become more vulnerable to these effects. The key here is awareness and communication. When you talk to your doctor or pharmacist, ask the direct question, does this medication affect memory or thinking? Are there alternatives that would be safer for my brain? You have every right to understand what you're putting in your body and how it might affect your mind. Sometimes a simple switch to a different drug or even a lower dose can give you the relief you need without the hidden cost to your cognitive health. Moving on to our second category, let's discuss sleep medications and sedatives, including a class of drugs called benzodiazepines. If you've ever struggled with sleepless nights or anxiety, you know how tempting these medications can be. They work, often quite well, by slowing down your brain activity and helping you feel calm or drowsy. But here's the concerning part. That same brain-slowing effect that helps you sleep can also interfere with your memory and thinking over time. Your brain needs those natural cycles of activity and rest to stay healthy. When medications artificially suppress brain function night after night, it's like dimming the lights in a house. Eventually, things start to break down from lack of proper illumination. Studies have shown that long-term use of these sleep aids and anti-anxiety medications can significantly increase the risk of developing dementia. Let me tell you about Robert, a 76-year-old retired teacher from Florida. After his wife passed away, Robert struggled with grief and insomnia. His doctor prescribed a benzodiazepine to help him sleep and cope with anxiety. For the first few months, Robert felt grateful for the relief. But gradually, his children noticed troubling changes. Robert became forgetful, had trouble following conversations, and seemed increasingly confused about daily tasks. When his daughter accompanied him to a doctor's appointment and mentioned these concerns, the doctor immediately suspected the sleep medication might be part of the problem. Together, they created a plan to slowly reduce Robert's dependence on the medication while introducing other sleep strategies. It wasn't easy, and it took time, but as Robert weaned off the drug, his mental clarity began to return. He started sleeping better naturally and felt more like himself during the day. What Robert's experience shows us is that these medications often provide short-term relief at the expense of long-term brain health. The challenge is that sleep problems are incredibly common among seniors, and these drugs offer quick relief when you're desperate for rest. Doctors often prescribe them because they understand how lack of sleep affects quality of life. But the long-term cognitive risks are often underestimated or not fully explained. Older adults also process these medications more slowly, so the drugs stay in their system longer, increasing the likelihood of side effects like confusion, dizziness, and falls. If you're currently using sleep aids or anti-anxiety medications regularly, don't panic, but do start a conversation with your healthcare provider. Ask about the risks, explore alternative approaches like sleep hygiene techniques, relaxation methods, or cognitive behavioral therapy for insomnia. Sometimes simple changes like reducing screen time before bed, keeping a consistent sleep schedule, or practicing deep breathing exercises can make a surprising difference. The goal isn't to suffer through sleepless nights. It's to find safer ways to get the rest you need while protecting your brain for the long haul. Sleep is crucial for brain health, but so is choosing the right way to achieve it. If you're finding this information helpful and eye-opening, please take a moment to comment the number 3 below. It helps me know you're following along and finding value in what we're discussing. And if you haven't already, make sure to subscribe and hit that notification bell so you don't miss future videos that could protect your health and the health of your loved ones. Your support means everything and helps us continue sharing important information like this. Now, let's move to our third category, certain antidepressants. Mental health is incredibly important, and antidepressants have helped millions of people manage depression, anxiety, and other conditions that can seriously impact quality of life. But like many medications, not all antidepressants are the same when it comes to their effects on memory and thinking, especially in older adults. Some of the older types of antidepressants, particularly what doctors call tricyclic antidepressants, can have significant effects on cognitive function. These medications work by changing the levels of brain chemicals like serotonin and norepinephrine, which can improve mood, but sometimes at the cost of mental sharpness. The side effects can include memory problems, confusion, and slower thinking, symptoms that might be mistaken for normal aging or early dementia when they're actually related to the medication itself. Consider the story of Patricia, a 68-year-old retired librarian from Oregon. After losing her job due to budget cuts and facing financial stress, Patricia developed depression. Her doctor prescribed a tricyclic antidepressant, which did help improve her mood over the following months. But Patricia began experiencing troubling symptoms. She'd lose her train of thought mid-sentence, forget familiar words, and struggle to concentrate on books, something she'd always loved. Her family worried she might be developing dementia. Fortunately, when Patricia saw a new doctor for a routine checkup, he took a comprehensive look at all her medications. He explained that her antidepressant, while effective for depression, might be contributing to her cognitive difficulties. Working together, they gradually transitioned Patricia to a newer type of antidepressant, with fewer effects on memory and thinking. Over several months, Patricia's mental clarity improved significantly while her mood remained stable. The important thing to understand is that this doesn't mean antidepressants are bad or that people should avoid treating depression. Depression itself can cause memory problems and cognitive difficulties, so treating it is often crucial for overall brain health. The key is finding the right medication that addresses mental health needs without unnecessarily compromising cognitive function. Sometimes older antidepressants are prescribed because they're effective and often less expensive than newer options. But the potential impact on brain health, especially in seniors, needs to be carefully weighed in that decision. This is particularly important for people who already have risk factors for dementia or who are experiencing memory concerns. If you or someone you love is taking antidepressants, especially older types like tricyclics, it's worth having a conversation with your healthcare provider about potential cognitive side effects. Ask whether there are alternative medications or therapies that could provide similar benefits for mood while being gentler on memory and thinking. And remember, never stop or change antidepressant medications without professional guidance. These drugs often need to be adjusted gradually to avoid serious side effects. The relationship between antidepressants and cognitive health is complex, but being informed helps you work with your healthcare team to find the best approach for your individual situation. Mental health and brain health don't have to be competing priorities. With the right medication and support, you can protect both. Finally, let's talk about over-the-counter PM pain relievers. These might be the most overlooked medications on our list because they seem so harmless. After all, you don't need a prescription. They're available at every drugstore, and they promise relief from both pain and sleeplessness. But these combination medications often contain ingredients like diphenhydramine, the same substance found in many allergy medications, which can have serious effects on brain function when used regularly by older adults. These PM formulas work by including a pain reliever like ibuprofen or acetaminophen, along with a sedating antihistamine to help you sleep. That sedating ingredient suppresses your central nervous system, which causes drowsiness, but can also dull brain function over time. When seniors use these medications frequently, they may experience memory problems, confusion, and increased dementia risk without realizing the connection. Think about Frank, a 73-year-old retired construction worker from Michigan who dealt with chronic back pain and occasional insomnia. Frank discovered that PM pain relievers helped him sleep better while managing his discomfort, so he started taking them almost nightly. Over time, Frank's wife noticed he was becoming more forgetful and sometimes seemed disoriented, especially in the morning. He'd forget conversations from the day before or get confused about appointments. During a routine visit, Frank mentioned his sleep and pain issues to his doctor, who asked about his medication use. When Frank listed the PM pain relievers he'd been taking regularly, his doctor immediately recognized a potential problem. The diphenhydramine in these medications can accumulate in older adult systems, leading to cognitive side effects that mimic or worsen age-related memory problems. Frank worked with his doctor to develop a different approach to managing his pain and sleep issues, including specific pain management strategies and better sleep hygiene practices. As he reduced his reliance on the PM medications, his mental clarity improved noticeably. The confusion lifted, and he felt more alert during the day. The challenge with these over-the-counter medications is that many people use them without medical supervision. They assume anything sold without a prescription must be safe for regular use, especially for seniors. Unfortunately, that's not always true. The aging brain is more sensitive to these sedating compounds, and they can build up over time, causing effects that seem like natural aging but are actually preventable medication side effects. If you regularly rely on PM pain relievers, it's worth discussing this with your healthcare provider. Ask about safer pain management alternatives or non-drug approaches like physical therapy, gentle exercise, heat therapy, or relaxation techniques. Your pharmacist can also be a valuable resource for understanding what's in these medications and whether they're appropriate for long-term use. Remember, protecting your brain health isn't just about prescription drugs. Over-the-counter medications can be just as impactful on your cognitive function. Being aware and cautious about what you take, even medications that seem harmless, can make a significant difference in maintaining your mental sharpness and overall quality of life. If you've stayed with me through this entire discussion and found these insights valuable, please comment the number 4 below. And if you haven't subscribed to our channel yet, I really encourage you to do so and turn on notifications. Your support helps us continue creating content that can truly make a difference in people's lives and health. As we wrap up today's discussion, let's take a moment to reflect on what we've covered. We've explored 4 categories of medications that can pose hidden risks to brain health in seniors: anticholinergic drugs found in allergy and bladder medications, sleep aids and sedatives that can cloud thinking over time, certain antidepressants that may affect memory and concentration, and over-the-counter PM pain relievers that many people use without realizing the cognitive risks. Understanding these risks isn't meant to frighten you or make you suspicious of all medications. Instead, it's about empowering you to be an informed advocate for your own health. Knowledge gives you the power to ask better questions, make more informed decisions, and work collaboratively with your healthcare team to find the safest, most effective treatments for your needs. The most important step you can take if you're currently using any of these medications is to have an open, honest conversation with your healthcare provider. Bring a list of everything you take, including over-the-counter medications and supplements. Ask specific questions about potential cognitive side effects and whether there are safer alternatives that could work just as well for your symptoms. Remember, this isn't about stopping essential treatments without professional guidance. Many times, doctors can help you find alternatives that manage your symptoms effectively while being gentler on your brain. You deserve to feel well physically and stay sharp mentally, and with the right approach, both goals are absolutely achievable. Your brain health is precious and irreplaceable. By staying informed, asking questions, and working closely with your healthcare team, you're taking powerful steps to protect your memory, your independence, and your quality of life for years to come. The choices you make today about medications can have a lasting impact on your cognitive health tomorrow. We'd love to hear from you in the comments below. Share one thing you learned today and how you plan to use this information in your own life or in caring for someone you love. Your experiences and thoughts can help others who are facing similar situations, and reading your comments motivates us to keep creating content that makes a real difference. If you found this video helpful and informative, please give it a thumbs up, share it with friends and family members who might benefit from this information, and subscribe to our channel for more health insights that could change your life. Thank you for spending your time with us today, and we look forward to seeing you in our next video where we'll continue exploring ways to live healthier, happier, and smarter as we age.